Right on.
Okay, so let's jump in. So I'm going to be talking on parents as partners, empowering families to prevent drug use. Um, this is an very important topic because it's about preventing drug use, and what other better place to prevent drug use than from the house. The house is a part of the community. So I'm Dr. Ubong Dofia. I'm a consultant psychiatrist, and below is my location and my social media handle. So my introduction, my outline will be, I will introduce the topic. I will talk about the numbers. Why is this topic important? Some parents could be asking, why did my child start using drugs? And others would be asking, why is my child not stopping drugs despite all the negative consequences happening? And it would be nice to know as a parent, what can you do about it? And we will conclude. So let's start by defining some terms. What is a drug? Another word for drug would be psychoactive substance or psychoactive drugs. So anything that is taken in to the body, and after taking it into the body, it can alter or affect your mental state. And by mental state would be perception, your emotions, your mood, your consciousness, and your behavior. It's also important to know the different classes of drugs. It's important because not all drugs are the same. Some have different effects. And I'll be focusing on the ones that are very commonly used. So we have cannabis, also known as marijuana. It causes euphoria, that good feeling. It causes relaxation. It can also change how you perceive your surrounding. Then there is stimulants, and a common stimulant that we know is cocaine or crack. Other types of stimulants would be amphetamine or methamphetamine, what is known as ice or nkurimiri. Okay. Other stimulants are caffeine and nicotine. They are called stimulants because once you take it, your body feels hyper, you're more energetic, you don't sleep at night. Then there's depressants. When you take depressants, your body feels a bit low, a bit drowsy, a bit down. And the most common depressant is alcohol. Other depressants are cough syrup, codeine. Okay. Then another class is inhalants, things, gaseous fumes that you breathe in to your nose, petrol, nail varnish, super glue. Now, some of you might be asking, why is cannabis not put in under stimulants or depressants or other classes? Because some forms of cannabis can act as stimulants, while other forms of cannabis can act as depressants. It's also important to, as an introduction, to have an idea of the street names of drugs. Now, this particular lecture or seminar or Zoom meeting is targeted at family members, the mother, the father. What can you do when your child or relative or a family friend is using drugs? Before you can do anything, you have to know exactly what is going on. You have to be armed with the knowledge and the information because you cannot act without knowledge. Hence, I'm taking my time to explain all of these terms. So the first drug is cannabis. It's also known as weed, kush, loud, Igbo, SK, Arizona, AZ. Then there's Colorado, also called Colos. There's this slang that has been happening on Colos, on Colos, on Colos, and you now have people dancing or acting up. So on Colos is another type of cannabis, and it's interesting to note that on Colorado is the only synthetic type of cannabis. This means that if somebody does a drug test, a routine drug test, it will not show up in the urine. Another name for Colorado is Zen, cripple, or Jowo. Cripple or Jowo based on the effect of the color. So you might see them hunching and treatment, right? So another common drug is cocaine. The street name is crack. So you might hear people say crack, stone, market. It's more popular to hear market. I beg, give me market. White snow or powder. Now I put some pictures down there. Okay, the last one is methamphetamine, ice, primary, and the rest. So I put some pictures. The first picture is the cannabis. The second picture is the first picture is the ice. These crystals. Now, as a product, it's sold in waterproof, usually transparent waterproof or black nylon. So if you see black nylon with the crystals, you're looking at ice. Then the middle one is crack cocaine. Now, it's not sold like this, so don't think you'll see these big chunks. What you would see is that you might see it in aluminum foil, wrapped very, very tiny. So when you now open it, it is as small as my hand. That's a pinch. That's how it's sold. So if you see this kind of thing, you know, okay, fine. We're looking at these drugs. Now, before we proceed, it's important to know what drug abuse is or substance use disorder. So it happens after you are using drugs. So your usage has now changed such that you are actually seeking the drugs on compulsion. You are seeking the drugs, you are using the drugs despite the fact that there is the negative consequences. So you have lost control over your drug use and you're still using despite the fact that there are negative consequences, legal, occupational, and otherwise. So one can say that substance use disorder is where there is a psychological or physical dependence on the drug, and that dependence is characterized that I'm using the drug, despite the fact that my life is in a mess. I'm still using the drug because I don't have control anymore over my drug use. So I've tried to explain what drug use is and when drug use has become an abuse or substance use disorder. Now, why is this topic important? Why is it important that we have this type of lectures or this type of talk? It's important because of the number of persons that are affected. On this slide, we have to the left, we have world population. And this was a study done by the UNODC, United Nations Office of Drug and Control. So they did a study in 2016 and 2021. In 2016, they observed that worldwide, 271 million persons were using drugs globally. And that accounted for 5.5%. Now, out of this 271 million people using, about 35 million had a substance use disorder. So they have gone beyond using and using despite the fact of having problems. Okay. So we now move forward to 2021. Another study was done globally, and it increased from 271 to 296. 5.8%. So more people, so as the world population is increasing, so is the drug using population, but it's not increasing the same way as the growth rate of the world, but it's more than, okay, and the number of persons who were having an SUD climbed to 39.5. Let's now go to the right side of the picture. This is Nigeria. We have about 200 and something million Nigerians. I hope I'm correct. Yes. And out of that number, we have 14.3 million Nigerians who were using in 2016. This study was published in 2017. The study was done. So people were examined. Research was done in 2016. So we looked at a full year, the entire year 2016, how many Nigerians were using drugs. And 14.3 million Nigerians, that is 14.4% out of the entire population. And in these 14.3 users, about 3 million had a drug use disorder, 21%. It's interesting to know that it's important because the drug use, persons who were abusing or who had a disorder was 12.9%. So 12.9% of persons who were using worldwide had a disorder, while for Nigeria, it was 21%. This means that so many people who are using have a disorder compared to the world population. It means that Nigeria is not doing well at all. Let's still go forward. The 2017 study showed that 1 in 7 Nigerians aged 15 to 64 are using drugs, and out of this population, 1 out of 4 persons are women. And I explained that 1 out of every 5 drug users suffer from the consequences of using drugs, which is the disorder I mentioned, the negative consequences. Now, cannabis, with 10.6 million users exist in Nigeria, and you find out that it's the highest frequency, so it's the most used drug in Nigeria, followed by opioids, cough syrup, and the rest, followed by amphetamine, and the last is cocaine. So many people are using drugs. It was so serious that NDLA reported that 40% of Nigerian youths are deeply involved in drug abuse. This slide basically tells you that the onset of drug use has been shown to occur at around 10 years of age. So by 10, persons actually have been seen to be using drugs, although the peak age, the age that you would usually find them more of the time, is between 18 and 25. So a study done in Lagos showed this is the age of onset, while in Umo here, it showed 14 to 19. So globally, between 11 years and 17 is the age of onset. So why are our kids, why are our friends, why are our family members, why are strangers, why are Nigerians starting to use drugs? Without understanding why, you will not know how to stop it. The only thing that you're going to be saying is, say no to drugs, or please stop the drugs. So we need to know why persons actually start drug use. The first reason that a person will start drug use is because it is an available way to get high. If it was not available, you will not be using it. So it is an available way to get high. Alcohol is a social drug. So one might feel that a wedding is not going well where there is no alcohol, or a burial is not going well where there's no alcohol. So the same way persons like weekends because they get to feel that highness, they get to escape reality for a bit, in the same way that certain age group actually use drugs. So it's an available avenue for highness. And number 2, experimentation. A young adult is known to want to experiment things. These are new experiences, so they want to try it out. Another reason that they would use drugs is because it's culture. So you have celebrity using, you have social media showcasing celebrities using, and it's packaged in a way that it's so cute. It's so nice. Like, if you're not doing it, you're old school. If you're not doing the drugs, you're whack. You're not there. So it's a culture thing. The way the Nigerian culture sees that weddings and burials or other social events are time to be happy, have some alcohol, and the rest, is the same way that drug use is a culture within a certain age grade. Other reasons that they would want to initiate the drug is that there is benefit. There is benefit. The first benefit is that it is psychological benefit. So they try the drugs and they find out that this actually takes away my depression. This takes away my anxiety. This makes me run from childhood trauma. Maybe the house help in my house or my uncle had sex with me without my permission, that is rape. So when I take this drug, I am able to run from the feeling. Also, family conflicts. Okay, family conflict. My mother is fighting with my father. I don't feel good. So the drugs is a way to distance myself from this. Still under the benefits is that there is social skills. I can talk to women better. I can perform better on stage. I can even do sex longer and better. So these are benefits that friends or persons will tell the next person, if you take this drug, it works for you. Also, there is this increase in internet of cyber crime or internet fraud. And the target audience or the target is persons working in a different country. So you have where we're supposed to be sleeping, where they are awake trying to do their cyber crime thing. So they need to be awake at night since the time zones are different. Also, peer pressure. There is this need to want to fit in so badly. The family model, the monkey see, monkey do. If my dad is using alcohol or drugs, I would want to try it. If my uncle is using drugs, I want to try it. Also, we are conditioned, human beings are conditioned to naturally want pleasure. You are almost abnormal if you don't want pleasure. So these are reasons why persons will initiate drug use. Now, focusing on the index audience, parents. Parenting styles have a way of increasing and reducing the risk of initiating drugs. Let's first look at the different types of parenting styles. There's authoritative parenting styles where the parent is available emotionally and responsive to the child's feelings and needs. While at the same time, he's also being demanding and strict and has expectations. You have to pass your exams. You must be upright. The second style is authoritarian. Now, this style is quite interesting because the parents believe that the child must be kept in place. Whatever, my word is law. You don't have any right to express yourself. Just listen, keep it in place. Number three is the permissive style. The permissive style, the parents accepts, doesn't punish, and it doesn't make too much demands or expectation on the child. So it's more like the parents want to be friends with the child. The last form is neglectful. These parents, they're not emotionally available to their kids, and they don't even have any demand. They're not strict. There are no expectations. So studies have shown that if a parent is doing authoritative parenting, it is linked with, it reduces the risk of drug use. Okay, while if a parent is doing neglectful parenting, there is associated increased risk. Studies show that persons who do permissive type of parenting style, the findings are variable. That is, some findings will show reduced risk, other findings will show increased risk. All right, so I mentioned that drugs are everywhere. You can get drugs anywhere. Even your next door neighbor might actually have drugs. So I explained why they initiate the drug use, right? Now, why do they continue despite the fact that life is not going well? Why do they continue? That's where we understand that drug abuse is a chronic relapsing disorder. When it has reached a point where you're using the drugs despite glaring evidence of your life not going well, you have entered the point where you are now in a disorder. And it's so interesting to note that certain persons had their brains scanned who had a disorder. And it was shown that the scan showed that there was a dysfunction in certain parts of the brain that had to do with memory, had to do with motivation and the reward. So this individual cannot consistently abstain. He can't even self-regulate. And sometimes he cannot even see that he has a problem despite evidence. So the studies have shown that certain parts of the brain that are responsible for decision-making process and goals is shut down. It's not working well. Other parts of the brain that has to do with habit formation. What habits is chosen in preference to others. as the basal ganglia show this a problem. So habits that are linked to drug use are preferably. Another part was the amygdala that showed that there were issues. Now, what other reason is there for maintenance? The reason is that not everybody get to have addiction. Not everybody gets to have a substance use disorder. In fact, studies show that persons who use alcohol, only 15 out of 100 will have a substance use disorder or will get addicted. While for cigarettes, nicotine, about 32 out of 100 will have this problem. Well, for cannabis, 9 out of 100. But now with the synthetic forms, it has increased to about 15 to 16. So the risk for having a disorder, it's not 100 in 100. It's on average about 20%, 20 people out of 100 will have this problem. That is why persons possibly maintain its use. All right, other reasons for, I'm watching my time so that I will not go beyond 30 minutes. Other reasons for maintenance, one might call this slide, these are just excuses. You're giving an excuse. These are not really reasons. One, there are no alternatives to the benefits that I derive from drugs, so I will use the drug. So if I'm bored and there are no alternatives to my boredom, I'll use the drugs. If I have poor problem-solving skills, I'll use the drugs. If I'm having persistent family conflict, I will use the drugs. If I have poor social skills, I would still be using the drugs to ensure that I'm getting what I need. If I'm battling with regular depression and anxiety, I will want to feel good, so I will use the drugs. Other reasons will be peer pressure. Sometimes they don't even know that they have a problem. Sometimes they know they have a problem, but you know how drug use has so much stigma linked to it, so they will not seek care. Sometimes they don't even know that help is available in Calabar at FMPH Calabar, where we work. They don't know that. And sometimes the attitude that they get from the health care staff is so bad that they don't want to come back again. They rather go on the street and do their thing. Okay. Now, we in our program, in our recovery program, we give persons suffering from an SUD and a disorder, a form to feel. And so many gave reasons why they are using instant happiness, helps me to sleep, helps me deal with stress, helps me to stop being too emotional, gives me courage, helps me have fun. So there are so many reasons why persons still use drugs. Now, what can you do as a parent? Number one, have knowledge. And number two, react. First thing, just know that if you have a child, automatically your child is already at risk. We don't really care who you are. We don't care the type of parent you are. If you'd like be a pastor or an imam, your child is at risk, number one. So when you understand this, you will know that as a parent, it is your right to check their bags and their rooms in their absence. And what are you looking out for? Lighters, tablets, powdery substances, fancy gadgets, because now drugs come in very weird forms, not like the one I showed you in the previous picture, dried grass. So when you now find these things, take a picture. Also, you get to look at your child's eyes. Are their eyes red or pink? It's important because not everybody has allergies. We run an outpatient drug program as well as an inpatient drug program. The outpatient is more of experimental, but it's not more experimental because it works for us. So we found out that some patients, just one, he comes to the program and his eyes are red and he's pretending he's itching. What's wrong with you? He said, I have allergy. We know he smoked before. All right, so they cannot account for the money you give them. They no longer keep to house rules anymore. Items are missing in your house and they are restless and irritable. They're getting more angry. Now, you are comparing them to before. And now this means that if you do not know your child, you cannot know the changes. But mothers these days, they know their children like the back of their palm. So these are things you look out for. Other changes you look out for, are they changes in their personal care or hygiene? Yes, when kids become teenagers, they might change their dressing style. They may begin to fly their hair, do dreads or dada. But you need to observe for a change in their personal care, a change in how they are doing at school, a change in how they relate with their family and friends and social wise. And as a parent, you need to know about drugs and the different reasons our kids may want to use drugs. After you have known this, what can you do? We're almost done. First thing is to repeatedly educate them about drugs, the way that you have been doing morning devotion in your house. Also do drug devotion. Because when a child from a young age is being taught about drugs, he has a sense of fear. Fear. Okay? But if you tell him about drugs in secondary school, like, I think. So you're creating a type of fear for him about drugs at a childhood age. Number two, ensure your home is a safe space. I put home in brackets because home is not a physical structure. Home is a person. Home is the mother and the father. So is the home a safe place? Does it meet the child's emotional and physical needs? If a child comes home, is he more exposed to emotional trauma? Is in his mind, I need to leave the house? Is the memory of home a place where I should not be? So emotions are important. As a parent, how do you express your emotions to your spouse when your child is looking? How do you attend to family conflicts? Another thing you can do is to teach problem solving and social skills. We teach this a lot in our drug program. And I've observed that so many of our participants don't know how to solve basic problems. We create scenarios where they are provoked such that they're now angry. And the first thing on their mind is, I want to smash this person's head on the wall. First thing. They don't know how to solve problems. And their social skills to an extent, not everybody though. A large number have very poor social skills. Now, another important thing to do, please, 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 and please, get rid of all drug-using family members. I don't care if it's your uncle who has influence in your house. Your child's life is very, very important. We did a study that showed that the risk of using in a child doubles where a family member is using. So because you're using the normal cigarette or alcohol, your child has an increased risk of using drugs or substance worse than it. Another important thing that we can do is introduce spirituality, Christianity, and the like. Studies have shown that persons who have spirituality and their mindset, it reduces the risk of increasing drugs. Now, when you see drugs in your child's bag, what do you do? Number one, take a picture and then get information about the drugs later. Number two, take a break. Go watch a movie for 30 minutes. Go play lawn tennis so that you can prevent that impulsive reaction that will cause you to shout at your kids, "You betrayed me." And that will cause your child to lock up. Take a break, calm your nerves down, then talk to your child. How do you talk to your child? We prefer assertiveness communication or assertive communication or mindfulness in communication. Number one, state clearly what you saw. Number two, state exactly how you feel. So you're communicating your emotions via words, not shouting and facial expressions. Then acknowledge their reason. They're using these drugs for a reason. This would now make them know, okay, this guy understands where I'm coming from. Get them to identify the reasons and assist them in finding alternatives to that reasons. But understand this, if their use has entered into addiction or substance abuse, please, 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 and please refer to a specialist. Talking to them, showing more love alone will not work. So refer to a professional. this would still be the best option. What we'll do, we would assess, we'll do detoxification and relapse prevention. Now, how can you know if the drug use has become a disorder? Has their level of personal care been affected? Has how regular they have been at school or their workplace been affected? Has their performance at school or their workplace been affected? Has the relationship with any family member been affected? So you rate the performance in carrying out their roles and responsibilities at home. Has it been affected? It's important to know that just because you observe that they are now using drugs, you now want to show them more love and more attention. If they have reached a point of addiction, showing them more love, more attention, giving them more money, it never works for addiction. Conclusion: drug use has been and is still on the increase. So being a child or a teenager in a drug-using environment like the world is a risk factor. So you need to be vigilant and proactive as a parent. Address family conflict. Children can see, even if you are fighting with your spouse in secret, they would see. Address any mental illness in your child, depression or anxiety. Address any trauma. Now we need to know what need is the drug meeting in the life of our kids. Help them find an alternative. Refer to the Calabar Addiction Recovery Program. Now, just a little bit about the Calabar Recovery Program. It is an inpatient or an outpatient drug recovery program. It's domiciled for now at the Federal Neuro-Psychiatric Hospital. We also have online services where persons suffering from addiction can benefit from relapse prevention. All right. So the last thing to do is to share this information with the next parent. Now, I put some links where you could get more resources. So go on YouTube, type in Ubon Udofia, to be specific, Ubon Udofia 3525, and it will give you so many resources on how to help the next person come out of drug addiction, what you need to know to overcome addiction. So thank you for joining me in this short conversation. I'm done.
Wow, that was a lovely session. Thank you very much, Dr. Obongudofia, for the insight. For people on the call, you can bear witness to the fact that he has done a great job giving us some other perspectives we may not have known about drug abuse, including parenting styles. So be you authoritative, authoritarian, permissive, whichever approach you use to parenting may affect the child either positively or negatively. And it will also influence how you detect whether your child is using drug or not, because you need to communicate with them, be in communication with them to know what's going on in their life. You can't be detached and know. So they may take solace in drug use and end up becoming addicted to these substances and become a menace to the society. So like him said, we should be vigilant. We should be proactive. Don't wait until it has happened before you say, what will I do? And start blaming yourself, blaming others, blaming the whole community. So thank you very much for the insight created. If you have a question, please show by raise of hand, and then we'll ask you to unmute so you can ask your questions. Dr. Obong, please let's have that privilege to ask you some set of questions.
Privilege granted.
Okay. Anybody willing to ask questions, please raise your hands and you'll be unmuted. Someone is already asking for the slides. we'll take note of your email and send it to you. Or better still, I could generate a Google form for you to fill in your email. But for the time being, you can type in your email into the chat box if you want the slide, so we can get back to you. Shafiu Haliru, you can unmute.
Okay, thank you, sir, for giving me the opportunity. Thank you, Mr. Presenter, for an insightful presentation. I was actually elated once I see the topic and I follow it. You have really done justice. The question where I want to ask is, in the case of women, young girls, and even married, what are the first telltale signs that one will notice that will hint maybe they are into substance? Thank you. I hope you get my question.
I hope you got it. Telltale signs.
Yes, yes,
Notice.
I got you.
Okay.
I got the question. Are you done? Do I answer or you're still asking questions?
I'm done. Thank you.
He's done.
Okay, the first telltale sign is that money will be missing. If money is not missing, items will be missing, because this persons, they need money to get the drugs. They need money to get the drugs. So if money is not missing, you will observe that their weight, their body is reducing. Okay, so there's no appetite to get to want to be eating, so they are reducing in weight. So things are missing, they're reducing in weight. And most importantly, they will be avoiding the family members. They will prefer to be on their own or to leave the house. So that bond that you had with your kids or your family will not be there again. And this might now create doubt in you. Am I a bad parent? What is causing this? Meanwhile, they are finding succor or a balm outside the house. Now, I forgot to mention as a reason why persons initiate drugs use is because drug use is a business. So the sellers, to a large extent, want your kids to be addicted because it means more money for them. So they are proactive sometimes in offering them free drugs. So I forgot to mention that. So I hope I've answered your question. And another thing is that I forgot to mention, the telltale sign to a large extent depends on the type of drug that is being used. So if a female is using cannabis, you'll be seeing the redness of the eyes. You'll also observe a change in their personal hygiene. The signs I mentioned to a large extent is universal. So if you're using crack, cocaine, or the rest, it will still show up. Okay, thank you.
Thank you, sir.
Thank you very much. Any other hand raised? Let me check the chat room. Okay, no hand is raised right now. Okay, apart from Raji. Okay, Raji Saeed.
Okay.
Yes.
Good evening.
Unmute.
Good evening. Thank you
Good
for the
evening,
lecture
sir.
and the opportunity given to me to to ask my question. The age for the onset of substance use in adolescents, Dr. Ubon tried to tell us that it's range between 11 to, I think, 17, if I'm not mistaken. But and when trying to counsel us on the way to address a child substance use in their children and adolescents, he mentioned that we should try and make an age-specific something. I've forgotten the word he used. So then is it possible for us to actually intervene before this age as a way of preventing the children from even starting, let's say, in younger age group, maybe like in children age group that are even before that age 11 of onset? Is it advisable to start talking to the children before this age so that the tendency of even getting, before even getting to the age at which the substance use will develop during which they are expected to have started experimenting or being influenced by peers or whatever? Is that advisable, sir? Thank you.
All right, thank you, Raji, for your question. I said that educating a child is important because once you have a child and the child can leave the house on their own, the risk of drug use initiation exists. Okay, and if you're telling your offspring in secondary school about drugs, it's too late. Why is it too late? It's one thing for a person to have knowledge that something is bad, and another thing to have a deep-seated fear of something. So if you start as a child to tell them about the drug use, it goes deeper into the subconscious that this thing is bad. So at that young age, you are showing them some pictures about what will happen if they start, So they have this subconscious type of phobia and hatred of fear that this thing, I should avoid it. That's why I said that one should be intentional. As you're intentional about sending him to nursery school or kindergarten, you should be intentional about psychoeducating the kids about drug use, because you want to put an image into their subconscious so that even when their friends are trying to cajole them, which they will have the resolve to say no to the drug. So yes, you can start as early as possible. The earlier the better. Thank you.
Thank you very much. Canis, your hand is up. Canis, you
Okay,
can unmute.
yes, I can unmute. Good evening, everyone. My name is Dr. Odofia Akanemo. I want to uh, greatly applaud what Dr. Ubo Odofia has done. It's quite impressive. I really enjoyed the session. I have a question actually, and it's bordered around the uh, epidemiology. Like you mentioned something that was very, very, the statistics initially when you started. You said 1 in 4 um, users are women, but you didn't tell us what men, the ratio for men is, and I'd love to know that actually.
Okay. Cadis, how are you doing now? By the way, Cadis is my cousin. It's nice to have you on this.
Thank you. Thank you.
All right. So if 1 in 4 users are women, then 3 in 4 should be men. So yes, so this statistics was lifted from the UNODC report for 2017. I don't know if there has been another global study from UNODC. I'm not sure, but if there were newer ones, fine. So 3 in 4 drug users are men, while 1 in 4 would be women. So 1/4 women and 3/4 would be men.
Okay. Thank you very much. That's very. Thank you.
You're welcome.
Yeah, thank you very much. I see no other hand up. It's already past 8, so we will shut down the session here. Once again, thank you very much, Dr. Obongo. An insightful lecture on a day like this.
Dr. Aldo, please, I want to encourage persons, if you want more resource, please just check
Okay.
my YouTube page. There are detailed
Okay.
videos on how to help the next person come out of addiction. Very detailed videos. And this has been shown to help persons who have been involved in our online aspect of the recovery program come out of addiction. So thank you.
So you've shared the YouTube page. I think you did it earlier. Can we see the YouTube page again? Okay. So that okay. Okay, so the YouTube page is also Ubongudofia.
Yes, it is.
Oh, perfect. So thank you once again. From the comments in the comment section, it's obvious attendees are pleased with the knowledge gleaned from your lecture this evening. Thank you very much, sir, for sparing your time to put us through this session. And to all who attended, I say thank you, because it wouldn't have been a webinar without you. So thanks for making that time to make it a worthwhile session. A beautiful night, everyone. Yeah, that's all. Thank you. So the session will now be shut down.